Today our topic is clavipectoral fascia from upper limb. So let's get started. So what is clavipectoral fascia? First we have to give an introduction about it. Clavipectoral fascia is a strong fascial sheet which is deep to the clavicular head of pectoralis major muscle. So it is nothing but a fascia. So in this image we can see this green color thing, right? So these are all the fascia. So this fascia is basically called the clavipectoral fascia. So as we know, for pectoralis major muscle, we have two heads. One is the clavicular head, another one is the sternal head, right? So this fascia is lying deep to which head of the pectoralis major muscle? It is the clavicular head, okay? And this is going to fill the space between the clavicle and the pectoralis minor muscle. So between the clavicle and pectoralis minor muscle, this fascia is going to be present, right? So let us see the extent of the pectoral fascia. So for extent, you can give three subheadings. One is the vertical extent, that is from top to bottom. Another is medial extent. Another one is the lateral extent. So just give these three headings for the extent and let's see how we have to present the question. So vertically it extends from clavicle above to the axillary fascia below. So starting off we have clavicle above. So this is the clavicular bone and we have below is the axillary fascia. So this fascia is axillary fascia. So vertically it is going to extend from the clavicle above to the axillary fascia below. So this is the clavipectoral fascia, okay? So here from the clavicle above we have the clavicle. So here we have clavipectoral fascia continuing, enclosing the muscle, again continuing downwards. And at the end we have the axillary fascia. So these three green lines you can see, this is the clavipectoral fascia. Hope you understood the vertical extent. Okay, so vertical extent, it extends from the clavicle above to the axillary fascia below. Now its upper part splits into two lamina. So upper part is going to split into two lamina and enclose the subclavius muscle. So here this is the subclavius muscle. Over here this brown color is the subclavius muscle. We know subclavius muscle is going to lie below our clavicle, right? So now this fascia, clavipectoral fascia, is going to divide into two lamina. This is one lamina and this is another lamina. Why is it dividing? So that it can enclose the muscle. Which muscle? Subclavius muscle, because it is present below the clavicle. So obviously it is subclavius muscle, right? So the upper part is going to split into two lamina and enclose the subclavius muscle. The posterior lamina becomes continuous with the investing layer of deep cervical fascia. Now we have the posterior layer. So it is again going to continue. So this is the investing layer of deep cervical fascia. So above it is going to continue as deep cervical fascia. Below it is going to get attached to the axillary fascia, right? And gets fused with the axillary sheath. Now the anterior lamina gets attached to the clavicle. So here you have the anterior lamina which is going to get attached to the clavicle, and the posterior lamina, it is going to get continued and gets attached to the axillary fascia and continues as deep investing layer of deep cervical fascia. Right, so what happens to the posterior lamina? You are going to tell it becomes continuous with the investing layer of deep cervical fascia and gets fused with the axillary fascia. And what about the anterior lamina? It gets attached to the clavicle, of course. Right, so next we are going to see about the lower part. Lower part is going to split to enclose the pectoralis minor muscle. So now here we have the lower part. The lower part is again going to split. Now here this split is in order to enclose the pectoralis minor muscle. Above it split to enclose the subclavius muscle. Below it is splitting to enclose the pectoralis minor muscle. So here fascia is going to cover two muscles. One is the subclavius muscle, another one is the pectoralis minor muscle, right? So below we can write this muscle is extending downward. This muscle is extending downwards as suspensory ligament of axilla. So again it is going to extend downwards, and here we see after enclosing it is going to join again and it is going to become a single fascia, and that is called suspensory ligament of axilla. Okay, so that is called suspensory ligament of axilla. Now this suspensory ligament is going to get attached to the axillary fascia, a dome. Okay, so dome shaped axillary fascia. Okay, so which is attached to dome of axillary fascia. The suspensory ligament keeps the dome of axillary fascia pulled up, thus maintaining the concavity of the axilla. So we all know our axilla is concave in shape. So then the fascia of the axilla is also going to be concave. Now this suspensory ligament of axilla has a pulling effect so that this dome shape of the axilla is maintained. If something happens to this ligament, then the concavity will be lost and axillary fascia will be flat. It can no longer be concave, right? So the suspensory ligament of axilla is going to maintain the concavity of the axillary fascia. So next we have, it is going to maintain the dome of the axillary fascia, thus maintaining the concavity of the axilla. So next we have again two. Now the vertical extent is done. Then we have the horizontal extent. That is from medial to lateral, you can say, right? So medially what happens and laterally what happens. So medially we can see the clavipectoral fascia is attached to the first rib. So medially it is attached to the first rib. Costoclavicular ligament. So what is costoclavicular ligament? Here we have our costoclavicular ligament. So the costal part of your rib and the clavicle gets attached by this ligament. So it is called as costoclavicular. So this is the costal part of the first rib. So this is your first rib and this is the costal surface of your first rib. So this costal surface and the clavicle, here you have your clavicle. So the ligament that is going to attach both of them is called as costoclavicular ligament, right? So clavipectoral fascia is attached to the first rib and costoclavicular ligament, and it is going to bend with the external intercostal membrane of the upper two intercostal spaces. So it is, you have to see this green color you have, right? The light green one. So this is going to be your clavipectoral fascia. So it is attached to the first rib. It is getting attached to the costoclavicular ligament as well as the space intercostal membrane. Okay, external intercostal membrane. Next you have laterally, it is attached to the coracoid process and it is going to bend with coracoclavicular ligament. So here we have lateral part. So this is medial part and this is lateral part. Lateral part you have the coracoid process. Okay, in the shoulder joint side you have the coracoid process, right? So you have the coracoid process and you have the coracoclavicular ligament. So what is coracoclavicular ligament? This dark green color thing which is going to attach the coracoid process and the clavicle. So thus the name coracoclavicular ligament. Okay, so here we have costoclavicular, here we have coracoclavicular. Here costal part and the clavicle it attached, so it is the name the costoclavicular. Here it is going to attach the coracoid process to the clavicle. So we are having coracoclavicular as the name. Okay, so laterally we have, it is getting attached to the coracoid process and it is going to bend with the coracoclavicular ligament. Okay, the thick upper part of the fascia extending from the first rib near the costochondral junction to the coracoid process is called as costocoracoid ligament. So we also have another ligament called costocoracoid ligament, but I think in the picture it is not shown here. The thick upper part of the fascia, so the upper part of the fascia, it is going to extend from the first rib near the costochondral junction. From the first rib near the costochondral junction, it is going to extend to the coracoid process. Okay, so it is called as costocoracoid ligament. Now, the clavipectoral fascia encloses two muscles. So, we already saw while studying the vertical extent, right? It is enclosing two muscles. One is the subclavius muscle, which is present below the clavicle. Another one is the pectoralis minor muscle. Okay, done. Now, then the next subheading should be, after writing the introduction, what is it? It is a fascia so and so. You have to write the extent, vertical extent, medial and lateral. After which you are going to write the structures piercing the clavipectoral fascia. So what are the structures that are going to pierce this fascia? So you can draw this diagram for that. So for this we have a simple mnemonic called clap. C-L-A-P, clap. Okay, so C for cephalic vein. So here we have our cephalic vein, blue color, which is going to continue as axillary vein. Okay, then L for lymphatics. Okay, so obviously you will have lymphatics. Acromiothoracic artery. So we have acromiothoracic artery, which is going to continue as axillary artery. And you have the pectoral nerve, lateral pectoral nerve, which is going to continue as the lateral branch of lateral cord of brachial plexus. Okay, so these are the structures that are piercing the clavipectoral fascia. So this is our clavipectoral fascia. So what are the structures piercing clavipectoral fascia? C for cephalic vein, L for lymphatics, and A for acromiothoracic artery, and again P for lateral pectoral nerve. Clap is going to pierce the clavipectoral fascia. So remember, clavipectoral, C-L-A you have in the name itself, and pectoral P. Okay, so C-L-A-P, clap for clavipectoral fascia. Just remember that. Okay. Thoracoacromial artery, you can also call it as acromiothoracic artery. We know they have two names, right? So lymphatics from the breast to the apical group of the axillary lymph nodes. So these lymphatics, we all know from the axillary, from the breast, some of the lymphatics are drained into the apical group of axillary lymph node. So that lymph node is present over here. And cephalic vein. Okay, so we have cephalic vein, the lymphatics which are going to drain from the breast to the axillary lymph nodes, and we have acromiothoracic artery, which we can also called as thoracoacromial artery, and then we have the pectoral nerve, which is especially lateral pectoral nerve, and you can also write it is going to continue as what, like cephalic vein to axillary vein, lymphatics, and then acromiothoracic artery to axillary artery, and lateral pectoral nerve has a lateral cord of brachial plexus. So to remember acromiothoracic artery, it is acromion process you have here, right, near axilla, so thoracic part. So we are studying about that area. So remember acromiothoracic artery. Okay, so cephalic vein, lymphatics, acromiothoracic artery, and lateral pectoral nerve. So with this, our clavipectoral fascia topic comes to an end. So you can draw the diagram and explain the introduction, its extents, the structures piercing it, and what are the muscle getting enclosed by this fascia. Right. So thank you for watching.